Hey guys, it's Dr. James. Now, one commonality I find under long-term care with patients is essentially, oh doc, it doesn't matter what I'm doing right now. I feel a little bit better after my adjustments, but my pain is just not going away. Well, why is that? It's called inflammation. Now, there's a difference though. We have acute inflammation on one hand and chronic inflammation on the other. Now, here in America, most of us unfortunately suffer from chronic or sustained inflammation that can last months, can last years. Now, the acute scenario is typically when the patient would go ahead and bend down, let's pick up something off the ground or tweak my ankle and I got a sharp pain to the area. So what happens in an acute event? So in an acute event, your body will recruit cells to that area essentially to initiate the healing process, whether it's the tissue, the joint, so on and so forth. So I have my balloon here today that's going to represent our joint that essentially undergoes some type of acute event. So let's just say again, we subluxate our back. Inflammation sets in. Now, why do we feel better after a long period of time with acute inflammation through what we call the chiropractic adjustment? Is because each adjustment will essentially realign the bones of the spine, helping to disperse inflammation until it's gone, until the healing has been properly restored. Now, what's the difference between chronic inflammation? Now, most of us undergo chronic inflammation with the stuff we're shoving in our mouths daily. Sugar, MSG, aspartame, refined carbohydrates. Yes, gluten. It is a thing, guys. Gluten, wheat, barley, rye, alcohol. All of these things are going to cause what we call chronic inflammation. So what would chronic inflammation look at a joint? Bam, my joint is now inflamed. I go in for my adjustment. Day after, hey, let's have another soda. Joint becomes a little bit more inflamed. Hey, let's go in for my next adjustment. A little came out. I'm gonna go drink my next soda. More inflammation sets in. You guys get the idea. Now, inflammation on a chronic level has been associated with things like heart disease, have been associated with things like diabetes, obesity, things that are running rampant here in America each day. But you know what, Dr. James? I only have 1 can of soda per day. Okay, 1 can of soda, what's that, 38 grams of sugar? That's not too bad. Hey, 38 grams, my body can handle that. Well, let's times that by 365. You're looking at about 36 pounds of sugar per year. Now, let's span that over the course of a decade. You're looking at 360 pounds of sugar over the course of a decade from 1 sugary beverage per day. Now, does that sound like moderation to me? It does not, and it could be the result why you're in pain, why you're in discomfort, why you're having digestive dysfunction, acid reflux, trouble sleeping at night. You name it, chronic inflammation can cause all of this. So I urge each of you to set a goal for yourself to identify these areas in your life right now where you could be potentially consuming foods that are resulting in long-term chronic inflammation. And what it starts with is just trying to cut these foods out one at a time. A gluten-free diet, a dairy-free diet, an anti-inflammatory diet, a paleo diet, keto diet. There are many types of diets that are anti-inflammatory. So what I suggest is we get on one of those diets and we try it. You can find that you can consume many of the foods that you like with certain alternatives added to the food. For example, hey, I have celiac disease. I can't consume gluten. Well, rather than flour, we're gonna switch to an almond-based flour. Much of us need to be consuming more fish to balance the omega-3 to omega-6 fatty acids in our body, which will again lower levels of inflammation. So I give each of you the goal this month to identify that one inflammatory food in your diet and let's remove it. Let's cut it out. Let's start feeling better. Let's start thriving at our optimal. I look forward to seeing you guys here at your next adjustment. If you're looking for more information on how to properly eat, be sure to attend our food workshop here at the end of the month.